Can you see my PowerPoint, madam? Shall we start the session now, audience?
Yes, sir. Yes, sir. We can see your PowerPoint, sir. Yes, sir.
Hope all of you are able to see the slides. So let us start the session with the small basic introduction about healthcare system. What is an healthcare system? What are we going to go about? What are we going to learn about or know about healthcare systems of India? See, I will not be discussing this entire PPT about the global scenario. I will touch the global scenario a little bit, but majority of my focus will be towards our Indian healthcare system and how our Indian healthcare system adapted to face this COVID situation. So let me introduce again once again about myself. I'm Dr. Balaji, professional HOD, community medicine, working in Tagore Medical College. So this is the objectives. So the objectives of my session, two major objectives: to appreciate the healthcare system challenges faced by both the government sector as well as the private sectors during this COVID pandemic, and also to understand how this healthcare system adapted towards and making a multidimensional approach in managing this COVID pandemic, right? So the objectives is mainly to how we faced and how we got adapted, right? So these two are the main objectives of the session, and I will also add a little bit of my experience. So currently I am working as a nodal officer for our COVID care center. Our Tagore Medical College is one of the COVID care centers working excellently, and we have treated, actually I wanted to share all these success stories of our session, our medical college and also other healthcare system at the end. But being the nodal officer, I just want to give some basic information about what's going on in our college. So we have treated 100+ cases in the last almost 20 to 30 days in COVID care center in Tagore Medical College, with a success rate of more than 98%. Even other medical colleges have not yet touched that success rate. We are very close to 100%, but 98% is a success rate of our treatment. So I've been the coordinator for this Tagore COVID care centers and also liaison officer with the government health authorities. So let us start with the healthcare system challenges faced and also the adaptations that we have modified according to the COVID situation, right? So before going into or knowing about the challenges faced, so our Indian healthcare system, as we know, it is two broad categories, and one is public health. That public health means our government health sector and the private health sector, and also indigenous system of medicine. So public health sector, or we call it as a government sector, where we have 2 or 3 tiers actually to say: tertiary care level, secondary care level, and also primary care level. So primary care level, where this primary health centers, maybe all of you would have heard about Aramba Sugadhara Nilayam, that is called as primary health center, and Tunai Sugadhara Nilayam, that is actually sub-center. So that is at the village level, and hospitals and health centers at the block level, and also the rural or taluk headquarters hospital, district headquarters hospital, then teaching hospitals, then medical college institutions, corporate hospitals, and specialist hospitals. So all these things come under public health or government health sector. And our private health sector, we have all things like starting from small nursing home, because I'm also a practicing diabetologist and also a community physician and ID specialist also. So I'm doing my own personal clinic. That means starting from small nursing homes, managing the patients. So then next to going to the private hospitals, polyclinics, and corporate, the private corporate hospitals, and also general practitioners clinics. All these things come under the private health sector. And indigenous system of medicine, this is actually our ministry, our government, central government ministry have started a separate thing in the last 10 years, almost a decade back, that we call as Ayush. AYUSH. AY means Ayurveda, Unani, Siddha, and homeopathy. So nowadays we are giving more importance to this indigenous system of medicine, which is actually the soul of our Indian culture. Actually, Ayurveda, as you all know, or some of you may not aware, I want to tell you, Ayurvedic medicine is the base of our Indian culture. Means like Indian origin medicine is our Ayurvedic system of medicine. As you all know, there is an important word nowadays is Kabasura Kudini. So what is the system of medicine then? Kabasura Kudini, is it the system of medicine from allopathy or English medicine? No, it is actually from Siddha. So nowadays, not nowadays, it's almost a decade back. So we started giving more importance to Ayush also. So we divide our healthcare system. Our Indian healthcare system has got these three wings. So with this basic introduction, this is the Indian healthcare system, how it operates in the private side, government side, and also through Ayush. So let us just see the challenges one by one. So generally, we have some general challenges in healthcare system. Let us just discuss about the general healthcare system challenges. First one is, as you all know, there is an increasing cost to treat the demand for chronic diseases. Chronic diseases means like diabetes, hypertension, ischemic heart disease, that is heart attack, cancer, all these things we call it as a chronic group of diseases. And as you all know, this needs a long-term treatment, and the risk factors which causing these diseases are multidimensional, multifactorial causation diseases. So very difficult to prevent and also very difficult to treat, because these diseases needs long-term treatment, right? So those treatments, especially for cancer, as you all know, for cancer management, we have an excellent secondary and tertiary care level of management and treatment for cancers, but the cost is high, okay, right? So increasing cost, right? And we are also having another burden, we call it as we also have to deal with the existing infectious or communicable diseases. So these chronic diseases, we used to call it as a non-communicable disease. That means which will not transmit from person to person. But infectious diseases, as you know, it gets transmitted from person to person, like COVID. So coronavirus gets transmitted from person to person. So we have to deal with the continuously existing infectious diseases also. And also emerging health risks. At more than 2 decades, we are fighting against this obesity, psychological issues, especially psychiatric problems like depression. As you all know about, Sushant Singh recently got committed suicide because of depression. I'm not going into detail about his particular case. I'm just telling about he also suffered from depression and a lot more other psychological and psychiatric diseases we are dealing with. So obesity, psychological issues, and also smoking and alcoholism, these are all continuous risk factors, emerging health risks. And also coping with emerging and re-emerging. So we are coming to our point now. So these are all general challenges. So 4th important point, coping with emerging and re-emerging infections like tuberculosis and SARS. What is SARS? So now we are facing that SARS-CoV. NCOV, as you all know, novel coronavirus, sudden acute respiratory distress syndrome, respiratory stress syndrome, and influenza pandemic, and also continuous problems with the communicable diseases like HIV/AIDS. So now already we are having the burden of both communicable and non-communicable diseases. And this pandemic of coronavirus, which got transmitted somehow from China to all the parts of the world. So the entire world is fighting against this prevention, treatment, all those things are going on. So these are all the challenges that we are facing. So now, these are all general challenges. As we finish with general challenges, let us focus on some of the challenges, especially this COVID situation, right? So the healthcare system challenges specific to COVID. So look at this point. This is very, very important. See, around the world, it is being challenged by increasing demand for care of the people with COVID-19, right? All of a sudden, majority of the people, every day the number of cases are increasing. Majority of the people are getting affected with the disease. And there is an increasing demand for care of the people, those who are affected with COVID-19. This problem is compounded with fear, very, very important thing. Everybody got scared. Right? So fear, miscommunication, misinformation about this coronavirus. This is again a very important, maybe you can call it as a darker aspect of boom in technology. This booming in technology is actually transmitting a lot of misinformations, and also the limitation of movement of people, especially which has disrupted the delivery of healthcare to all the people for serving certain conditions, and also while maintaining the delivery of routine health service. This is the major challenge, right? See, we are supposed to respond or treat the coronavirus patients, those who are infected, those who are having some sickness, those who are having some severity of illness. And similarly, we are supposed to manage or run the routine health services. Also, this is the biggest challenge. All of a sudden, as we all know, we have went for a lockdown so many times, and now we are in unlock 3.0 or something. So this lockdown has disrupted the delivery of healthcare system to people, especially those who are having non-communicable diseases, diabetic people. They were not able to go to the general health services. They were not even able to go for a general physician to consult for regular consultation. and they are scared to come out of the house. So once they stop coming out of the house, there is no movement at all. So there is no walking, physical activity is reduced, fear, stress, everything is escalated because of this COVID situation, right? So we as a healthcare sector person or a doctor, the major problem that we have faced is, one side is managing the current situation of treating the patient with COVID-19, and another thing is maintaining the delivery of routine health services. So let us see how we manage with these situations, right? So I'm just going to see one more slide by slide, a little more in detail about the challenges that we have faced. Most of you will be able to appreciate this. So the natural history of COVID-19 virus. So let me just tell you what is natural history. See, any disease or any virus or the agent, as it enters into the human body, it has got its own course of development of symptoms and development of clinical symptoms into the patient, and then complications and then recovery, right? This is the natural history of this any coronavirus or any virus or the bacteria, right? So let us talk about one by one. Spread. First of all, the spread of the virus. Initially, it was told that it was transmitted from some animals, some bats, from some fish market in China, and later on it was then refined to say that it is a person-to-person transmission by droplet infection. And then recently, WHO has said that it is not only a droplet infection; it is also airborne. So this natural history of the virus, still we are studying, still we are able to find out a lot of complete the natural history of virus, the spread of the spread, and also the symptoms, how it manifests with the patients, and also emergency warning signs, so that it will be told to it will be clearly informed to the patients, so whether if they experience these symptoms, where they should go, how they should approach the health sector or health clinic. And next important thing is to find out or diagnose, testing and contact tracing. As a community physician and epidemiologist, when Priyadashini madam and me were talking about this, how you are able to cope up, sir, madam was asking about all these things. I personally had this problem when we went for contact tracing in the beginning. We used to get some people from in the beginning, means like I used to say in the March first week, second week, even before we started our lockdown. March first week, second week, people coming from abroad and all, they used to come and then they will be screened casually in the airport, and then they will be sent to their respective hometowns, right? So we used to go and trace those people, whether they develop any symptoms or something like that, and the contacts for those people also. So we had very difficulty in contact tracing. Till now, government people are doing an excellent job in, especially the contact tracing is a very, very difficult thing. Initially, we had a very difficult thing, and now also because the spread has increased very much, so sometimes very difficult to get the contacts also, and people are also not able to, they are also not telling whether they are having the contacts and all, they are masking their symptoms, they are not coming out of their symptoms. All these problems are very difficult to come out. And also people at high risk of illness, especially comorbid conditions, especially people with chronic diabetic or any other chronic illness, they are already having some immunosuppression. These immunosuppressed individuals, they are at high risk of, especially the severity of coronavirus pneumonitis will be much more, and the affection and the complications due to coronavirus is much more people with having any other chronic illness. And then, yes, very difficult thing is cleaning and disinfection. As you all know, we have been talking about hand hygiene, sanitizer, mask, and disinfection using sodium hypochlorite and all those things. So the cleaning and disinfection has become a very big challenge, and also some people are telling initially sodium chloride, they were telling about bleaching powder, they were telling about different disinfection procedures before we could get a standard operating protocol from the government and from the WHO. So this is the major problem with about the agent. So I'm just challenges from one by one. I'm just going from slide by slide. So this is the natural history about the virus. First challenge that we have faced. And next is human resources. This is a very big issue. Till now we are facing in the health sector. Travel restrictions, as you all know, we had some lockdown issues. So travel restrictions imposed under the lockdown. So this has made the workers being infected with virus, or if they are infected, they have to be kept in quarantine for 14 days. All those things were there implemented during the initial part of the pandemic. So it created a lot of fear among the general public. I can coin that word, fear psychosis. The workers, especially the frontline workers or healthcare workers, they all went in for a fear psychosis. Not only that individual, as madam was asking, it is not only the individual who is working. The entire family went in for a fear psychosis. So please, we would have also heard some of the clippings from ambulance driver talking to his mother. His mom was telling him, "Pa, please come home. Why you have to go to this job? You will also get infected, pa. Then how will you get treated?" So these sort of things that we have faced. So this is the human resources, yes, from all the levels. It is not only the driver level, everywhere, right? But shortage of, so all these things resulted in shortage of healthcare workers. That became a very big second important issue in the initial part of the pandemic. Yeah, next important thing is medical supplies and equipment. As you all know, everybody was rushing towards the medical shops and hospitals to get the mask and sanitizers, because it was imposed by the government and also by public health departments to say that please use mask, please wash your hands every hourly or 2 hourly, right? So these things were proposed, and continue washing your hands with sanitizers, use sanitizers. So this availability of masks and sanitizers, immediately there is a huge demand for masks and sanitizers, which also escalated the price of the mask and sanitizers also. But now everything got settled. And drugs, very important. Supportive medicines, government has come to a conclusion that to implement certain things, please, it has given a direction to all the medical departments not to dispense any of the drugs which is specifically used for the treatment of COVID. So that should not be indiscriminately used by the medical medical shops. So that should not be given over the counter by the shops to the people. So those things were there. And also we were not specific about which antiviral drug is very specific against this particular virus also. And also medical equipment for patient care. And very important issue, testing facilities and laboratory equipment. These things were a very, especially major issues that we have faced in the initial part of the pandemic. And let us see how we have come across all these challenges, right? And the infrastructure, very important infrastructure. The rapid spread of the coronavirus, people were running towards the hospitals. Those are having sick, they got very much scared, sir, right throat, sir. Everybody, they started coming to the clinic, they started rushing towards the government hospitals. And many of the private hospitals were shut because of the fear. So they are forced to go to the government hospitals. So number of government hospitals looking at the COVID cases has to be increased immediately. So there were some lag time in between. And medical college institutions, they were all running out of the wards and beds because of huge population. As we all know, India is a huge population, populous country. So population was moving towards, and ratio of confirmed patients to hospital beds and medical staffs. This is also a very important issue that we faced. And along with that, running the general and emergency health services parallel is a great challenge, which I was telling you. And this entire health infrastructure came to a standstill at a point of time. We were not able to do what we are not having a proper guidelines, what to do and what not to do. This was the major issue with the infrastructure, human resources, and also about our natural history of the virus. So challenges, there are some challenges faced by the private health sector also. The biggest challenge as a private doctor or a nurse in private clinician, and also working in a medical college in the private sector, we face two important big challenges. One is frequently changing regulations, SOPs. As I told you, SOP means standard operating protocols were modified time to time. So we were not able to implement the protocol. We'll be implementing a protocol for some time, and all of a sudden there will be some guidelines from ICMR, CDC, from WHO, and then from our central government. These people will immediately change. It is needed because this is all the responses needed. I am not against the guidelines or protocols, but these protocols have become very difficult to understand the protocols and then implementing the protocols and changing the protocols. This becomes a problem. And next important thing, as you all know, irrational price problems faced by the private health sector. So they were not able to get through the profit and also the return on capital employed. This was a huge problem because the preferred, of course, despite being preferred over the government hospitals for healthcare by a large section of population, the private health sector had been witnessing a major problem, especially profitability and ROCE. Hope you guys know about this, return on capital employed. This is the major problem as a private health sector that we have faced. So how are we going to approach this pandemic. Of course, this is not the final step that we have attained right now that I'm going to discuss. I'm going to discuss from the beginning what was the first step initiated by the government side and also the private side, setting up of a dedicated COVID-19 hospital. That was the biggest immediate need, because as I told you, first need is to respond to the patient, those who are infected with COVID-19. So patient care needed, first time we need a dedicated COVID-19 hospital. So that was initiated, that was proposed in the beginning, and then running a separate fever clinic to identify or to pick up especially the patients showing COVID-19 signs and symptoms. And then gradually we were moving on to temporary isolation or quarantine centers. Many of the hospitals were also being converted into isolation or quarantine centers. As you all know, Kalyana Mandapams and also many schools, hospitals, many medical college premises, schools, everything have been converted into temporary community isolation centers, especially for people, those who are having contacts. These I was managing as a nodal officer. We had monitored more than 1,000 people across this Chengalpattu district. Under our Chengalpattu deputy director also, we have monitored more than almost 1,000 people within a span of 3 to 4 weeks. 3 to 4 weeks. So huge demand of the human resources was needed. Of course, we also got scared, but still we were able to manage with this temporary community isolation centers and transition care centers with the help of home healthcare, also home healthcare providers, and this was also provided through corporation and also by government to facilitate the out of hospital care, because not all the people will be able to admit in the hospital, because there was a huge demand and the huge population were approaching the hospital. So we are also planning for some out of the hospital care approach also. So that resulted in appropriate use of teleconsultations and of course, as a private doctor, I was also doing a teleconsultation through mobile, WhatsApp, especially WhatsApp video call and all I was doing, which was also proposed by our state government and also the central government, because we don't want our 60 plus people with comorbid illness to come into contact with the external atmosphere. We don't want them to harbor the agent, right? So we don't want them to get infected. So there should be a solution. So we were trying to give some teleconsultations, and that was also a success. And central government or state government also, they have initiated a teleconsultation websites and video conferencing websites were also created. That has also given a little bit good response by the community and also by the doctors. And technology enabled the system of mapping. As you all know about our central government app, mobile application was initiated by the central government to find out the containment zones, so that you can easily find out if you can download the app, then you can easily find out that is there any containment zone in your area, how far you are away from a COVID positive patients. Those things were we were able to. So these were the immediate. This is what we call it as a disaster immediate response. So we responded to this pandemic step by step. See, these steps I may be a little bit this side that side for this points may differ, but we adapted all this multi-dimensional approach in the beginning as an immediate response to specifically for COVID, right? So this was the multi-dimensional approach initiated. Now let's see what was the major 4 measures that our Indian government or central government or India is proposing to face this COVID pandemic. Increasing the testing capacity and PPE production. As you all know, personal protective equipments, PPE, that is a very important thing for any healthcare provider, without any fear for providing a care to an infected patient. So in order not to get infected, so that is very important, right? So as a PPE is very, very important. That production was immediately increased, and also the increasing the testing capacity by providing lot of other laboratories, testing kits, and also the supplies. So India's domestic PPE kit production has been great success story, as you all know, because we were not able to get this PPE kits and also the testing equipments from outside the country. That also happened from little bit, but we wanted to be self-sustained. In order to be self-sustained, we have to increase our production. So that production was immensely increased. So this is very important supporting system. So all the doctors and also other healthcare providers, So we were able to give proper care to the patients with the PPE. That was a very important step, and also increasing testing capacity. This is the success of increasing the number of labs. You can't imagine such a large country with a huge number of population and huge pandemic situation. Our country is able to increase the number of labs. This is as on August 1st. If you go and check out the website right now, because now we are in August 6th. So if you check out now, definitely the number of labs will be much more than this. So every day we are trying to improve. So government side, the number of labs currently working is 913, and private labs are also included, and the total number of labs they're doing COVID-19, all those things, these are all numbers. So I would like to tell you this is the increasing in testing capacity that India have responded well, and August 1st we had this many number of labs for testing COVID-19. Yes, maintaining the regular health services. So this is a very big challenge which I again I'm stressing upon. So maintaining the essential critical health services, very important thing, right? Say patient developing a myocardial infarction. என்ன பண்ண முடியும் சார்? கோவிட் கேர் ஹாஸ்பிட்டல், you cannot be admitted in this hospital. MI, just imagine myocardial infarction, heart attack. The patient, if you do not respond to him immediately, if you do not start the treatment immediately, patient will die, right? So we have to, at one point of time, we have to treat all the patients as COVID patients, and we were delivering the critical care healthcare services, and also all the other national health programs, government related disease health programs. We were all running parallelly. That became a very, very difficult thing. See, there should not be any resurgence of already vaccine preventable diseases because focusing only towards COVID, that will only focus towards COVID and then not taking about the count of other chronic diseases and other vaccine preventable diseases. What will happen? What will happen in another 3 to 5 years? Then we will have to face this vaccine preventable diseases which are under control right now. Then that will become a very difficult issue also. And then running the casualty and emergency health service, creating the infrastructure for regular and emergency services, and strict maintenance of disinfection prevention measures. This is very, very important. Every medical establishment, they have to have their own infection control team, and that infection control team, I am also part of infection control team in our college. Though this infection prevention control team has to take care of this entire cleaning and disinfection procedures with the healthcare workers, that has to be monitored, so to keep against the coronavirus in the establishment, right? And then enforcing the emergency measures. This is very, very, very important, right? So enforcing the emergency measures, enforcing sensible social distancing. Like social distancing, a word has become so famous among all the people. Two important words. One is quarantine and social distancing, right? And effective quarantine procedures, mandatory mask wearing. In spite of us telling several times, many people, they have not developed the attitude to use this mask and all. And you would have seen a lot of video demonstrations, doctors talking about health education, about wearing of the mask. But still, we could see people going around, and especially in marketplaces, they forget about the social distancing. Because when I used to, last 2 weeks back also, I have given a telephonic interview to our Tandi TV and some more private channels also. I used to tell about these 2 points, stress about these 2 points. Any doctor, if you ask them some points, prevention, we will always talk about social distancing and mandatory mask wearing, and also hand hygiene habits, along with detection, containment, and mitigation, right? For example, right, see our Unlock 3.0 document has got all these things. You can go and verify from the central government website. So wearing of face coverings is compulsory in public places and workplaces, and also during the transport. So because we don't want, during the transport, we don't want the virus to be transmitted to some places where the virus is not there, which is what happened. So initially there was no cases, a very less number of cases outside the part of Chennai. Everybody got scared to come to Chennai, but now you know the scenario. Now the scenario is almost vice versa. But we will come out of all these things in near future, I can assure you. And individual must maintain the distance of some 6 feet and 2 meters and all those things. And marriage, funeral, all these things, there were some guidelines were given, and penalty for violating the lockdown measures. These enforcing the emergency measures has become mandatory out of fear, not only out of fear about the disease, also because our attitude, the Makroda attitude, but initially they were actually got a lot of fear about the disease. Now they have become so casual. Majority of the population, as far as I'm concerned, okay, right? So the opinion may vary person to person. As far as I'm concerned, Gradually people are coming out of the fear, and then see, coming out of the fear is different, and being careless is different. So as you can understand the difference between these two, right? See, coming out of the fear and being cautious is okay, but being careless, it will not only affect you, it will affect your family and also the community, right? And enabling the responsible monitoring through nodal officers for COVID care centers. This is very, very important. As I told you, nodal officers, I am one of the nodal officers appointed by our private sector. Obtaining data on COVID patients, especially if you are running a COVID care center, and proper reporting through case information format, and also form CAF form, that is also called as epidemiological case sheets. Proper death auditing of the patients, those who die of COVID-19, and state and central government websites for updating the information. Every day we are reporting to more than 11 to 12 authorities. That flow of information is going from down to top, and mobile-based applications, web-based monitoring of the data, and having Zoom meetings and also Google meetings through government health authorities, how we are able to manage. 2 days also I attended the Zoom meeting with our CMCHS scheme. So they are monitoring on regular basis all the private hospitals. They are very much interested in rendering the help. We will be having a special scenario. I can tell you an example as a special scenario. A special scenario which arises in one of the hospitals where both mom and dad, they got affected with the COVID. That they are having a child of 3-year-old, right? So now everywhere there is a lockdown. They cannot put their children's child age, which they got only one kid at 3-year-old. So 3-year-old, we cannot separate the child from the parents also. So that was a special situation. What you will do? Quarantine situation. See, we have faced lot of special situations like this. So we are monitoring all these things. So government people are very much interested in rendering the help in this this sort of special situations also. And mobile applications for assessing the containment zones, which I have told you about. I think Arogya Setu is our central government app. Many other private apps are also available. So these are all our steps, major steps. And now we are in August 6th. Our testing capacity has increased a lot. Of course, many people are still telling that we need to increase a lot of testing labs and all. Yes, I agree with all of those things. Yes, I will just before I complete, we are almost at the conclusion of my session. I would like to share a success story of a COVID care center where we had 500 critical care beds, not only COVID care beds, 500 critical care beds alone with more than 100 ventilators working for 120 days. That is for 4 months, continuously 24/7 with 400 plus doctors, nurses and technicians and also supportive staff. They have never scared to treat a COVID patient. More than 12,000 inpatients have been treated with success rate of more than 90%. They have been discharged from the government and private hospitals. This is one of the stories given from one of the COVID care centers. This is not the number from the entire Tamil Nadu or any other area. So please don't mistake these numbers. These are all numbers of a particular COVID care center run by government, right? And 8,500 CT scans. Imagine within 4 months, 8,500 CT scans. Entire radiology team, laboratory technicians team, CT technician team, anesthetists, physicians, lab department, everything were working full time. All the other doctors also running tirelessly till now. So what else one can expect from a government health sector? Government health sector is doing their maximum, and also we need to, as a private sector, also we need to support the government, and also we need to implement the SOPs and standard operating protocols implemented with the government. And still it is not over. We are ready to face COVID with lot more energy. Additional oxygen supply is also there. That also we procured, and many doctors, nurses, we felt sick. Yes, we all felt sick. We also got affected with COVID-19, and then we became asymptomatic. We became okay and coming back with full of energy to treat the patients. That is our responsibility. So we have come back with a lot more energy. This is the conclusion slide. It is not only me. I salute all the people, those who work along with healthcare providers, doctors, police people, journalists, reporters, and sanitary workers. See, imagine the amount of work that they have done, especially disposing the biomedical waste produced by the patient. Who will dispose? sanitary workers, everybody, big salute to our, all the frontline workers, including the doctors and all the team. So thank you for all that you do, including me, I'm telling. So I'm not the real hero. Of course, there are a lot of real heroes out there, and we value every single effort to save every life, every life. Love you all, and I hope all of you have liked my presentation. And the presentation was would be very useful. I think I have touched almost all the points. I wanted to finish up as quickly as possible. It was a little bit slow. Hope all of you understood my presentation. Go to our Dr. Priyadashini ma'am. Any questions? Apart
Yes, sir.
from political based questions, you can ask about healthcare system based questions, right? Please do
Yes,
not
sir.
approach me with any political based questions. I may not be able to answer. Right? So
Yes,
let us
sir.
have some discussion session now. Yes, I'm ready for discussion.
Okay, sir. Thank you, sir. Thank you for a very wonderful session.
Thanks,
And
sir.
I think the participants would have had some takeaways. You have given a lot of tips also how to keep ourselves healthy, and you have also like made it like very easy for the participants. So thank you for your time, sir, and thank you for a very wonderful session. And participant, the floor is yours. You can pose any questions. Any questions from the participant side?
Participants, you can ask any questions. If you are not able to ask the question, you can also put the question in the chat box. I will
Yes.
try to answer the question also. Some of you may not be able to frame
Yes, sir.
questions in the favor. So you can also put the question in the chat box. Let us have the discussion for another 5-10 minutes. I'm ready.
You can also ask questions related to COVID, healthcare, and in future, what how the healthcare sector. Sir has addressed on many things, but if you have any other questions or you have any of your personal cases you want to discuss, also you can discuss with sir.
So I'm getting a lot more calls, especially I just saw a message, just trigger the question from one of my patients, for the participants. So one of my neighbor is sending a message to me that, sir, one of my relative got affected with COVID-19. What should I do? This is the first question to all of you, right? So I just want to make it as an FAQ, frequently asked questions by many of the patients. For the participants, I want to tell you that if you or getting a confirmed case of COVID or getting a laboratory report. So immediately contact a nearby doctor first. Please do not self-medicate. Please avoid self-medicate yourself with azithromycin. Right? This is the most common mistake, but by our people do. So if you are positive with COVID, please do not get panic. Approach a nearby medical doctor. If it is not possible, approach the website, central government website, and also a state government website. I can say the website name also, Stop Corona website in Tamil Nadu. Tamil Nadu has done a wonderful job. Stop Corona website where you can enter and without password or login, you can identify the phone numbers of doctors. Even you can find out my phone number also in the Tagore Medical College, this thing. So you can find out the people, those who are in charge for admitting the patients in that particular hospital. So you can find out, make a call, and that is what I'm doing. You can make a call to that particular person or a doctor and then find out the availability of patient beds and all those things. And then through that particular person, you can be guided and get admitted in the hospital. Okay, this is the most common question asked because we have to respond immediately. Please do not get panic. So any questions from the participants?
They are asking what about this Kabasura Kudineer? How is it?
Yes, madam. Yes, so this Kabasura Kudineer, actually I have told you that is actually a Siddha medicine. I can tell you openly that being an allopathic doctor or an English medicine doctor, I cannot comment anything about Kabasura Kudineer, but there are some evidences. There are some evidences which was proposed or published in some of the research papers. They say that it reduces the severity of the disease. It reduces the severity of the disease. So Kabasura Kudineer can have Kabasura Kudineer definitely. but we can't say that it will prevent the infection. It will prevent, say, coronavirus varamala tadukadu. It will not prevent from the disease, but the severity may be a little bit less compared to people those who are taking and not taking. This was an evidence proposed by the National Institute of Siddha.
Thank you, sir.
Hope I answered the question, madam. How to use PMJAY
Yes, sir.
for treating poor once they become positive, right? See, PMJAY scheme is a unique scheme, especially for COVID positive. First thing is, with the report or wherever the government hospital that you get, see, as you know, this scheme can only be implemented mainly through government sector, right? So, as the patient to go with the report to get admitted with the COVID care center hospital, so that they will register everything. Two important documents are needed. One is, as you know, now Aadhaar card is needed for all your registering. So Aadhaar card is definitely in need. So you need to submit certain documents along with your test results, and further things they will take care. You need not do anything if the patient is a poor patient. You can also inform to your neighbors, those who are poor or getting affected, like auto drivers, rickshaw pullers, motor thukuravanga, where they will go. So this problem will be solved out with that particular scheme. How to differentiate ordinary cold and COVID symptoms? To say frankly that it's very difficult to differentiate between ordinary cold and COVID symptoms. See, COVID symptoms and ordinary cold, there is no much difference at all. COVID symptoms, as it's been already repeatedly told by many sources, you will have mild running nose, sore throat, throat pain will be there, and you will also have a little bit cough with expectoration. Sometimes you will also get some dry cough, and once the infection sets in a little bit more, the patient will get affected with pneumonia. So pneumonia settle aayidchuna, the patient will develop breathlessness. These are all the common symptoms. But for normal cold, you will not be having breathlessness and all those things and all, right? That is the only difference. But normal cold, and this because the climate is also changing now, many patients are presenting with sore throat. So nowadays it becomes difficult to differentiate between normal cold and COVID. But please do not self-medicate yourself, and also please approach a doctor. This is the main thing that I can tell you. Next, really, which type of mask should be used for normal people to prevent COVID? Yeah, this is nice. This is a very good question actually. See, for normal people, see, Englamari or doctors, those who are seeing the patients is different. Okay, for you guys, you can use best in getting enough. It is triple layer mask, disposable triple layer mask is important, right? But you can also go for an alternate. First choice is triple layer mask. As you all know, it is disposable. Once they get the disposable mask, the same disposable mask, they will use it for 3 days, 4 days. So COVID, where are the disease on the they start using that because of money, lack of money, what to do? But cloth mask can be used, provided if you are, once it is getting soiled, please wash it thoroughly with a disinfectant or sanitizer, or even normal soap washing is also enough. Then you can use that mask, cloth mask. Okay, right? So it is not mandatory that you are supposed to use the triple layer mask, N95 mask. Triple layer mask, N95 mask is mainly for healthcare providers. Okay, right? For normal people, you can use even triple layer mask if you are affordable. If you are not affordable, you can go for cloth mask, provided if you are cleaning it repeatedly and regularly with soap and water. Hope I have answered you the question.
Yes, sir. You're very frequent. It is also one of the FAQ questions.
Yes, madam. Because
Yes,
I conducted so many health education sessions, maybe I can say more than 50 plus health education sessions.
Oh.
Which I have conducted more than 50 plus through Zoom. Many people, my patients, having a WhatsApp group, I've been.
Okay.
This is what a community physician can do. Prevention. We have to talk to the people, madam. It is not so easy to change the attitude of the people all of a sudden overnight. It's not possible. See,
Yes,
a doctor knows everything, but they are getting scared to come and treat the patients, right? It's happening every common man, you can expect all these things. So
yes, sir. Sure, sir.
Hello, sir.
Yes, please.
Sir, tell me, please. I am old as 65 years.
Yes.
What precautions to be taken in regard to food and other activities, sir?
65-year-old, any, see, first point, the old age is old age with the comorbid illness, they are at high risk, right? So food, there is no particular specific food which fight against COVID-19. First, please understand that, right? So there is no specific food to fight against coronavirus, first point. So second point, generally, if the patient is not a diabetic or hypertensive, tell them to eat normal food. The patient can take some additional vitamin supplements. That is better. That is definitely better. So vitamin supplements can be added additionally the normal with the normal food. Otherwise, people telling eating ginger, hot water, this, that, this drink, that drink. I'm telling you openly, if it works for you, you can follow it. But if it causes some illness because it causes some side effects because of something is that you are using newly, so please don't land up in some other problem. So there is no specific food for fighting against coronavirus. Generally, some immunity developing food items will be better, and then please add some vitamin supplements. That is better after getting consultation from your doctor. Okay.
Okay, sir.
Okay, sir. Thank you, sir.
Welcome.
Thank you, sir.
Welcome, sir.
Okay,
Any
sir.
other
Thank you.
questions, participants?
So this is a great opportunity, guys. You can ask any question related to coronavirus treatment also. This is a great opportunity. Don't lose this opportunity. Another 10 minutes, once I sign out, you cannot call and ask me these questions. Okay, right? So please utilize this opportunity. I'll wait for another 5 minutes, or if not, we'll close the session, madam.
Yes, sir. So any other questions? Hope there are no much questions, sir. So thank you, sir. Thank you for your time. And we know you are in a very stressful job, and which is like not only physical, even and mental also, because you have to hear a lot from a lot of people. So it is a very, very difficult thing, sir. So, but you are doing it in a very brighter way, and you look stress-free also. So that's nice to learn from you. So thank you, sir. Thanks for your valuable time. And it was a very interactive session, and it was a very informative session, sir. So thank you, sir. Thank you for being with us. Thank you, participants.
Thank you so much, ma'am. You can give my phone number to our participants of this program.
Okay.
Definitely provide my mobile number to all of them.
Oh, great of you, sir.
They can call me, or they can send a message by WhatsApp or message or something. I can respond whenever I'm free.
Sure, sir. So nice of you, sir.
That I
Really
can
so
do
nice
maximum for my community. I'm ready to do it. Please, you can share my mobile number to all of them. Thanks a lot
Sure,
for
Thank you, sir.
the introduction, and it's a nice experience for me also.
Yes, sir. Thank you, sir.
Thank
Thank you,
you.
participants. Yes, sir.
Shall we
Thank you,
sign
sir.
off, madam?
Yes, sir. You can sign off, sir.
Thank you, madam. Bye.
Thank you, sir.